Good morning to everybody. Tune in to the press briefing, TV viewers, and people listening on the radio. Updating on the international situation, firstly, let me start by saying that the number of countries with the disease remain at 182, with 1,800,308 confirmed COVID-19 cases, 72,300 more than yesterday. However, I am forced because I heard this morning, I saw it on television, if I'm not mistaken, in the morning magazine. I should say that this is the cut until 12 o'clock midnight. But I heard that already there is, it's possible that there is more than 2 million people who have been confirmed with this disease. The number of deaths from this disease has increased by 5,321 from one day to the next, and 113,513 have already accumulated, for a rate of 6.28, which is similar to yesterday's, but a little higher. What really remains is that 98.3% of the countries have the transmission of the disease, which is 179 countries. Specifically in the region of the Americas, there is a total of 647,192 confirmed cases, with more than 40,000 in one day. 35.8% of the total number reported in the world are from the Americas, and 25,621 people who have died come from the region of the Americas. This is gives a lethality rate of 2.96%. There were no entry or exit operations in our country yesterday, and in any case, 12,473 people remain in Cuba, of which 5,490 are foreigners and 1,064 are Cubans residing abroad. And as we have said, Santiago de Cuba and the municipalities of Plaza, Centro Habana, and Playa are the ones where they have the highest number of foreigners staying at rental houses. We have 2,501 patients admitted to the hospitals, 221 who are under surveillance, 1,629 who are suspects, and 611 confirmed. In primary healthcare, we have 7,167 people being monitored. For the diagnosis of COVID-19, 1,634 samples were studied, again more than 1,000. In the IPK laboratory, 763, and in the laboratories of molecular biology of Santiago de Cuba, 187, in Villa Clara, 338, in the laboratory in Havana, 185, and in the laboratory of the Civil Defense, 161. As a result of the study of those 1,634 samples that were conducted yesterday, 40 persons tested positive for 2.4% of the samples studied. This is similar in the percentage to those of the previous day. In this way, the country has accumulated 18,864 samples, of which 766 were positive for 4% of the sample taken. Of the new 40 cases that were confirmed yesterday, which make a total of 766 in the country, all were Cubans. 22 were contacts from confirmed cases. One was of a traveler's contact, and the source of infection is being investigated for 17 cases. This number is increasing because these are cases in which it's not easy to establish the epidemiological relationship with the person who has come from abroad or with a confirmed case. Of the 40 cases diagnosed, 21 were female. For 46.9% of all these days have remained at a proportion of 40 to 51% between female and male. 20% of that is to say, 8 of the 40 new confirmed cases were asymptomatic, something which I have referred on this on other occasions. I have referred to the importance of looking at these groups that are asymptomatic, studying them and trying to identify people who are asymptomatic. The most affected age groups are those from 50 to 60 years of age, of which there are 15 people, and those under 40, there are 15 people as well, which represents 37.5% respectively. The most represented province is Havana with 29 cases. Of the confirmed cases, summarizing the situation of the 29 cases in Havana, 6 are from the municipality of Centro Habana, 5 from East Havana, 4 from Marianao. La Lisa and El Cerro, 3 each, 10 de Octubre and Cotorro municipalities, 2 in each, and 1 case diagnosed in Playa, Guanabacoa, Boyeros, and Arroyo Naranjo, respectively. Mayabeque province confirms 2 cases from San Jose de las Lajas and Madruga. Villa Clara, 1 case from the municipality of Cifuentes. Santi Espiritus province with 3, from the municipality of Santi Espiritus 2, and Cabayuan 1. Ciego de Ávila province 2, from the municipalities of Ciego de Ávila and Morón. Holguín province 1, from the municipality of Mayari, and Guantánamo 2 from municipality of Baracoa. As I was telling you that out of the 766 patients who have been diagnosed since we started studying this disease, 599 maintain a stable clinical evolution. As we explained yesterday, a total of 21 deaths have been reported for a lethality of 2.7%. We have had 2 evacuations and 132 discharges. Yesterday there were 11 more discharges. 9 patients remain reported as in critical condition today, and 3 remain reported in serious condition. Of the 9 patients who are in critical condition, 5 are in Havana. 1 is in the Dr. Luis Diaz Soto Hospital, which is a naval hospital, and another one is in the IPK hospital. In the Salvador Allende hospital, there are 3 critical patients. In the Villa Clara Province Military Hospital, there are 2, and in the Santiago de Cuba Military Hospital, there are 2 patients as well. Of the serious cases, 1 is in the Salvador Allende Hospital, 1 is in the Camagüey Military Hospital, and 1 is in the Fermín Valdés Domínguez Hospital in Holguín Province. 2 critical patients and 1 serious patient were added to these categories. There are 5 patients that were reported in serious condition who have had a favorable evolution and now are under the category of guarded, a state that somehow evidences a recovery. Of the critical patients, giving more elements on them, 2 are from Villa Clara, 5 are from Havana, and 2 are from Santiago de Cuba province. Of the associated pathologies, 1 case has ischemic cardiopathy, 4 have high blood pressure, 1 has neuropathy, 3 have diabetes, 1 has adrenal insufficiency, and 1 has chronic obstructive pulmonary disease, 1 has a malignant tumor, 1 has hyperthyroidism, and 1 has leukemia. In the case of the serious cases, 1 is from Havana, 1 is from Ciego de Ávila, and 1 is from Holguín, and 1 has an associated ischemic cardiopathy, 1 has arterial hypertension, and 1 is obese. These are risk factors that, as we have also said, are present in these patients, and they condition the evolution that is not very favorable in these cases. Before I move on to the questions, I would like to refer to some subjects. I have been told by a group of people who have sent me messages in relation to cats and the transmission of the disease. I believed I referred to this subject on one occasion. I explained that it had been demonstrated in Australia that it was, in the case of the patient, I think it was in Australia, it was confirmed that the cat was studied, samples were taken, nasopharyngeal samples, and the cat tested positive. That cat appears to have developed the disease, but there have not been any other similar reports, despite the large number, the thousands of cases that have been already been confirmed with the disease. So far, no data confirms that there is established transmission of the disease to cats, and I mean a cat or any other pet, that the cat develops the disease or that the cat itself becomes a source of infection. I've been asked about fumigation. If we know the way of transmission of the disease, we realize that fumigation, with the term that as we know it here in Cuba, is to kill vectors like mosquitoes and sometimes cockroaches, which are not the vectors for this disease. Anyway, here in Cuba, it is important to always maintain a level of fumigation, but not precisely because of COVID-19, but because the infestation with the Aedes aegypti mosquito, of which the Cuban people have enough culture. If we have seen water being sprayed with chlorine in our country, there are images that I have seen in Santiago de Cuba and in other countries. We've seen how this procedure goes with pressure hoses spraying chlorine, because unquestionably this helps avoid that the virus exists on some surface, let's say in the street. We have to remember that there are people who sometimes expectorate and do it in the street, and so there is a chance of the presence of the virus on the street, and so this is a way to eliminate the presence of the virus in this way.